All right, I'm gonna put together a general, relaxing 15-minute chair massage for you. A lot of the general things you want to focus on your massage, your general relaxing chair massage with your client, is to be able to space out your time. So dividing 15 in half, you would be like 7.5 minutes on both sides, working integratively, and you choose how you want to go about it. But usually you want to start off with a light, into a medium, into a harder, meaning more firm pressures. When you can be able to integrate a combination of different massage techniques as Swedish, shiatsu, deep tissue, things of that massage style, you'll be able to create a sequence that will allow you to do enough time, 7.5 minutes on both sides. So from here, I'm just going to get into a general relaxing 15, and then you'll be able to just be able to watch.
Excellent, excellent, excellent. We have made it again for another episode with Aboriginal Holistic Remedies. This is Jovi and Bay, your massage therapist, licensed, certified, insured, and ready to set you up with the greatest relief session you've have ever had. Today we're going to introduce a chair massage, a 15-minute relaxing chair massage, and the warm-up routine, starting off with some Swedish routines, Swedish techniques, palm pressing, doing a series of palm presses, allowing for the experience to feel enriching and stimulating. Right there, I was indicating the area specifically I was going to start working on, but I edited it so we can just see a little bit more of these palm presses with a different hand position. Right here, she was having some bra issues. Anybody's get pushed on, probably gonna have some bra issues, so she had to adjust. So from here, you want to work through the lower back, moving into what's called the shiatsu 13. It's a series of 13 or more presses. You can feel free to run across about 1 inch, half an inch away from the mid vertical spine, getting into a lot of the extensors, even some small multifidus if possible, and then running it back. You see the arms are extended and we're leaning forward and holding and stabilizing with your other hands. So you want to do a 2 series shiatsu 13 after your series of palm presses and after your effleurage, petrissage, and hand kneading. We didn't really show too much of that, but we're going to go ahead and just move into a different position. The front side position in front of the chair is ideal for you to work in the shoulder neck area. The muscles in these shoulder trap, levator scap, upper trap, extensors. You have so many of these neck muscles stabilizing, helping you have great posture, along with how you sleep, and falling off your pillow plays a big role on also how your upper body and shoulder girdles are feeling. especially if you're doing tech jobs, typing on the computer, using the mouse. These areas are number one complaint with tightness. Tightness, tightness, tightness. So firm pressure, these are the direct pressure shiatsu techniques with direct pressure with the fingertips, the thumbs into palm presses. So we're just showing you a combination of Swedish and shiatsu, getting into occipitals, the base of the skull, maintaining my tempo. One key thing to learn as a massage therapist is to learn the language of the Golgi sensors, the tendons, the muscles, the fascia, the fluids. There is a connection and integration within all of it, being able to find yourself in the moment where you can feel and sense and shift and shape and see the differences with the manual therapy. The massage techniques allows for one to really integrate their practice to the next level. Chair massage was the number one thing we learned in massage school, and I learned it in such a way with the group of instructors and I, and it ran. Did so many massages on the massage chair. Now I own a few different massage chairs. They're all different types, different body heights and fittings. This one we're using the Oak Works. This one my instructor had, so kind of clung to me and got it used. Ended up working out. So we're still working, doing a series of palm pressing, and the palm pressing is still focusing on those shoulder trap, arm, shoulder stabilizer muscles. So we're getting into the infraspinatus, upper trap, medial trap, rhomboids, trying to pull on the upper trap at the very end of my pushes. It's a dual technique. So ideally, if you can have someone face forward, lean forward, and be relaxed like this, you'll be able to apply a pressure and be able to cup and grip the skin and the shoulder and the skin fascia, and apply this pressure over clothes as well. So taking my time, making sure the Golgi sensors are comfortable with my approach. If you go in too fast, too strong, too deep, the Golgi sensors have a reactful, defensive personality type, and I've noticed through the years you really need to warm up what's called the fascia tissue layers. The metabolic waste sits in between and above the skin and the muscular system. It collects in this area almost as like a reservoir. Moving into what's called the deep tissue part of the chair massage, where you learn how to use your forearm into elbow and be able just to apply that much more pressure by leaning your body forward in your archer split squat stance and finding the muscular areas and the bony landmarks to avoid during this process. Specifically, finding the dense connective tissue along with fascia and body fat is what you're going to come across, and you just want to apply pressure in firm, confident, gentle manner, where the Golgi sensors and the nervous system is not flinching and responding in defense. This is the key to your approach into the chair massage that I like to experience, let alone give. So we're indicating the areas of specifically you want to apply your pressure towards. Shoulder blade area is the upper shoulder into the trap, into the neck. Lower trap is where it begins, the lower trapezius. And then after that you start getting into the lower vertebra, into the QL, quadratus lumborum, being able to sink the pressure in there just enough for them to breathe in and breathe out through that series of pressure. If you move at a too fast rate, if you move at an alarming speed, or if you just move fast in general, it still has an effect, yet it's not lasting enough. This experience just opens you up with more pressure, more time on pressure within the areas that actually hurt, actually feel the feedback. We have two sets of nerves we're dealing with, along with metabolic waste fluid and muscular tissue, and then a human being's conscious brain going through the experience of what their body has gone through and what they put themselves through. These movements and techniques alone will allow an individual to feel great for a whole 3-4 days, maybe even a week, maybe in a month. Receiving a chair massage, a relaxing chair massage after what I just did now is the most ideal way to be able to experience it. Light, medium, into the deep tissue techniques. Thank you guys. Like, subscribe. Look forward to seeing you on the next one.